Hi, I am Dr. Rashmi Chaudhary, the consultant obstetrician and gynecologist working in Cloud9 Hospital, Bellandur, Bangalore. Heartburn in pregnancy is a very common and distressing problem which interferes with the lifestyle of a woman. Because of that, they are not able to eat, and also it causes weight loss, which panics a woman as well as their family members. The heartburn is also known as the reflux esophagitis or acid indigestion. It mostly happens because of the disturbed hormonal status, increased level of the progesterone hormones, which causes the relaxation of the lower esophageal sphincter, and there is a reflux of acid from the stomach into the esophagus, which causes a burning sensation from bottom of the breast towards the entire throat. Increased level of progesterone hormones in pregnancy causes the relaxation of the lower esophageal sphincter, as well as it decreases the motility of the gut. It increases constipations, as well as the enlarging uterus puts pressure over the diaphragm, and the gut motility and all is disturbed. Even the fried food also aggravates the problem. Associated gallbladder also can increase the problem. So the management of heartburn in pregnancy depends upon the changed lifestyle, healthy eating habits, and some sort of modification in the dietary pattern. We encourage the lady to have 3 meals, 3 snacks throughout the day. They should eat at a time less, but they should have frequent meals. They should take food at 3 hours intervals. They should not be empty stomach for 4 to 5 hours, longer than that. They should have lots of fluids, like 3 to 4 liter water intake should be there on an average. They should increase the content of roughage in their normal diet. They should take more of fruits, green leafy vegetables, and fibres. All these measures will relieve the constipation and will cause improvement in the symptoms of heartburn. Further, these patients, we tell them to avoid the very oily, spicy foods, because all these will cause the relaxation of the lower esophageal sphincters. After the food, after the eating, we advise them not to lie down immediately. We advise them to walk for about 15 to 20 minutes so that this reflux problem is decreased. While they are sleeping, they should sleep in a little propped up position. Head end should be elevated. They can use 2 to 3 pillows below their shoulders and head so that the reflux will be less. We can just minimize the problem, decrease the severity, but not completely stop the process of reflux esophagitis. If the patient is still having constipations with the dietary modification, it is not improving, then we advise them to go for some sort of laxative like syrup Duphalac or some mild lactative powder. We advise them, which has got no impact on the developing embryo or the fetus. If these measures also doesn't improve the symptoms, then we go for the syrups like muc and gel syrup or local antacids, either in the form of tablets or in the form of syrup. We advise them, which she is advised to take 3 times a day after breakfast, lunch and dinner. It can be supplemented with the use of some anti-acidity medicines like Rantac or pantoprazole. These medicines are taken twice a day, preferably half an hour before meal. It gives an immediate symptomatic relief. In very severe aggravated condition, when the gastritis is too much, esophagitis is increasing, we have to admit also the patients to the hospital, and we give them a very bland, non-spicy food and put them on IV pantoprazole or IV Rantac.